Since May, Health Canada has been reporting a shortage of Teva-Clobazam, a medication used to treat seizures. It's a shortage one Kitchener woman fears will have devastating health consequences for her 90-year-old father with epilepsy. He has just a 3-week supply left, but this shortage is expected to last until April.
There was that risk you weren't going to make it when you were, 50? At 90 to have the same thing happen, I don't know that you would survive another grand mal seizure.
Reverend John Dickinson developed epilepsy following a head injury in the 80s.
I had upper body problems at that time, pain in the left arm.
Several years later, Dickinson had a grand mal seizure. What he initially thought were heart issues were actually seizures. He was prescribed Fresium, and it worked well for years. When that drug patent was up, 2 generic versions of the Clobazam drug came out, one from Apotex and one from Teva-Pharmaceuticals.
And the APA, the seizure was breaking through. The seizure form was kind of like wrestling with an octopus.
He switched to the Teva version and there were no problems, until finding the drug became an issue in August when the pharmacy told them they were short.
So we're just kind of going store to store to store asking, do you have any? But the challenge is it's considered a controlled substance, so it's really difficult to get any kind of amount of them.
Health Canada tells us Teva has reported a shortage due to a manufacturing disruption. We reached out to Teva Pharmaceuticals for more information, but did not hear back in time for this broadcast. The Apo version, however, is available.
When we saw the neurologist, he said, well, switch to the Apo, and if there's a seizure, come back and see me. Well, I'm thinking, well, I'm not sure he's going to make it to come back to see you.
So one solution that has been suggested to me is that I go and get an American doctor, get American prescription, but they'll only give me 30 days supply, so I'd have to do this monthly.
That's not possible for Dickinson.
This is a life-saving medication that just all of a sudden is not available, and yet it's available elsewhere. So how can we get it, and who can help us?
While there is a website called Drug Shortages Canada, neurologist Edward Berkovich, who does not treat Dickinson, says it's not possible to check it every day as a busy clinician.
And so it makes it more difficult if we're not being told until a patient tells us.
Berkovich wants a long-term solution.
Patients rely on us to be able to provide the medication, and it makes it much more difficult when I'm trying to prescribe a medication that in a few months may not be available.
As of this broadcast, the anticipated end date of the Teva-Clobazam shortage is April 20th of 2025. In Kitchener, Mackey, City News.